So I've got a patient with a very painful corn and callus are in the area of the second metatarsal head or the plantar second metatarsal head. So these usually present when the patient limps in and says, I think I've got something in my foot, if they've never had one before. If they've usually had a corn before, they know what it feels like. So what we do is go ahead and remove all the callus overlying here. And you can see as we cut down through there, the scalpel actually gets stopped on that central hard section. That's how hard these corns get, that the scalpel won't actually cut through it. So we're using a number 15 blade single use Swan Morton scalpel here. So there's really super sharp and super sterile. So we go and keep removing that callus. And you see how really tough I'm having real difficulty getting through that central section. And you can imagine standing on something like a piece of glass or even a little stone stuck in the same position of your foot, and every time you put your foot to the ground, 5 to 10,000 times a day, it will irritate right in the same location. So it gets really, really irritable. So once we've gotten down through the callus cap and we're down level with the skin, we've still got a little bit to go here. What we do is we'll core this out and then try and you'll see it looks like there's some maceration on some tissue fluid being squeezed back out of the skin into the deeper tissues. So we'll just keep going there. Make sure this, obviously we want to do this as painlessly as possible, because if we try and sometimes when we try and do it dramatically, it's really painful for the patient. So sometimes we just chip it out in little sections, and it is the least pain of all the treatments. But then we usually have to get this central section out by actually digging with the tip of the scalpel. So we'll go ahead around that borderline of the living and the dead tissue, and you can actually see when you're in real life close up here, you can actually see that there's the clear distinction between the living and the dead skin, and we go ahead and just basically remove that out. And you can see underneath here that it's got this the white macerated sort of section from the just the corn pushing on the deeper tissues and pushing all the tissue fluid out into the deeper tissue. It's getting a little bit sore. You can usually just keep an eye on your patient, make sure they're not wincing or anything. It's really easy to get distracted down here and just concentrate on pushing this out and not watching the patient. And of course we do this with no anaesthetic or anything, just remove that. And it's come out, we've got a big chunk of that out. It's actually quite a large corn. You can see it's pretty translucent, really, really hard to squeeze, hard to cut through with the scalpel. So basically that's the bulk of the section. So we'll go ahead now and just remove as much of that as we can without hurting. Now sometimes these are a little bit too painful to finish the job all in one go, so what we'll do is get much of it out now like we have, and then maybe review it in 2 weeks once it's all settled down, and then we can go in there and just get the rest of the corn out. So that's a partial removal, and we'll go and get the rest out in about 2 weeks' time.